collaborative call. And this is Lindsay McIntosh and chairing the call. And welcome. So we want to go around and do introductions because we have some new folks joining us today. So what I'm going to do is start with who is here in the room with me. So as you know, my home base is COA. And also with me here is one of our coordinators. Joni, you want to say hi?
Hi, this is Joni Founders.
And Cheryl Wakefield, you know. Say hey, Cheryl.
Hi, my name's Cheryl Wakefield.
That's
hey,
it.
Cheryl.
Hey, Cheryl, yeah. And Cheryl is the one who takes care of getting all of the classes for the collaborative into the system and keeping track of the fidelities and et cetera, et cetera. And we also have a new person with us today here at COA. And this is, what? This is Amy Doherty. Amy, wave at the phone.
Good morning.
And Amy is our new marketing person, and we are thrilled to have her with us. And so we thought what better way for her to get a feel for what we're doing together at the collaborative than to have her join us for the call. So she's here with us today. And she brought pumpkin bread, and I'm sorry you can't have any of it, but it's really good. So let's go through who is on the call. I'm sorry. Oh, okay. I'm going to just go through the agents and do some introductions. First, we have another new person with us who is Meredith. And Meredith is with Telligent. And Meredith, before we introduce everybody else from all the other groups, would you introduce yourself and what Telligent does?
Sure. Can you hear me okay?
It's a little low, but we're okay.
Okay, thank you. So Telligent is the quality improvement organization contracted with Medicare for the states of Colorado, Iowa, and Illinois. And the reason I'm joining this morning is our new contract with Medicare has a task specific to diabetes and increasing access for DSME, especially for at-risk subpopulations. That being said, it's great that in Colorado we're so fortunate to have so many wonderful things already happening that I think our greatest opportunity here is to help collect data that we can ship into CMS that demonstrates the great work that you all are doing. Glad to be here. Thank you.
Oh, thanks for being here, Meredith. So as we all have been talking about how do we work more collaboratively with all of our programs as well as collaboratively with the medical world, the clinical world, here's another example of the quality improvement folks for Medicare joining us for the call. So I just think that's really exciting. So we're glad you're here, Meredith. So I'm just going to see who else is with us. I don't believe Kelly was going to be able to be here today, but is there anybody here who's with Colorado Department of Public Health and the Environment? Okay. Is Katie here with Colorado Department of Healthcare Policy and Finance? Okay. And I know Connie will be joining us shortly. Greg, are you on the call?
Lindsay, I'm actually here and I'm at my desk after all. So.
Oh, great. Okay. Hi, Connie.
Hi, thank you.
Sure. Is anyone here from the ADA? Melissa, are you here? Okay. How about, I know Lindsay was not able to be here today with Central Colorado AHAC, but I have an update from her. How about Glenda or Tanaka with Center for African American Health?
Good morning. This is Glenda Mitchell, and Tanaka Ship is actually out delivering launching a DSM class this morning, so she won't be with us.
Great. Well, welcome, Glenda. And I know Lucy was not able to be here with Colorado Neurologic Institute. And let me see, we already went through the introductions for COA. Is Sue or Brittany online with Hilltop? Okay, Is anyone here with Kaiser Permanente? Okay. How about Dawn with Kit Carson? Okay. How about in South Central? I know I heard Monica is here with us. Right, Monica?
Yes.
Yay. Okay. And from Southeast Colorado, I heard Crystal.
Yep, Crystal and Eve are both here. Good morning, this is Eve.
Good morning. Southwestern Colorado, any chance Kathleen is with us? Okay. How about University of Colorado? Ellen, are you with us?
This is Julie, and I'm here from UC Health.
Hi, Julie. Welcome.
Thanks.
And Wells County, I believe Holly was not going to be able to be with us today. Is there anybody we haven't said hi to yet?
This is Mary Pat Gallis from COA.
Well, hi, Mary Pat Gallis.
I'm not sitting at the table, but
Okay, great.
I'm here.
Good. Well, welcome, one and all. Well, I wanted to give just a couple of quick updates and a little introduction on the collaborative for those of you who haven't been on the call. We brought together this collaborative a couple of years ago, and the idea was for us all to be able to share what was happening across the state, share some best practices, share in funding opportunities as they came up. And about the same time we were all meeting to form the collaborative came the first funding opportunity, which was the grant that Connie shares with us about, which is through AOA down through our state unit, and we're now heading into year 3 of that funding opportunity. But the goal has always been about how do we as a state share best practices, help fill our classes, look towards sustaining the programs and growing the programs because we know it's a great program. So that is the purpose for the collaborative. And so we've had the opportunity to do some really nice agreements, some fidelity, work together, and now we're starting in some other projects together. But I wanted to give you just a couple of updates on some of the work that I've been involved with on the national level. So this week, one of my duties as through COA is that I chair the Community Integrated Healthcare Work Group, which is out of the National Council on Aging. And as you know, the National Council on Aging does the technical assistance and support for the funding that comes down through the AOA, and as well as funding and, technical support around all things involving the chronic disease program series. So I chair that call, and on the call was Cora Plath, and Cora is the new person who is heading the Chronic Disease Self-Management Education Resource Center. And so she was on the call, as well as Kathleen Cameron. And Kathleen is the person who is the technical assistance person for the new falls prevention program funding. So the falls grant that came through recently, and the state of Colorado did receive funding for that, is all about falls prevention. And Kathy is actually the person who is going to be coordinating the resources nationally for that. So she is in a similar role to what Cora does with the chronic disease programs. So the reason I bring all this up is it was exciting to me that the falls program and the chronic disease programs were both on the same call, all talking about community integrated healthcare and how do we work to connect what's happening in the medical community to what's happening in all of our classes in the community, and how do we get people into classes. And for the first time, everybody's really talking about not just the chronic disease program or falls program, but how do we approach all of them working together. And so part of the excitement was, for the very first time, the falls prevention group and the chronic disease group are going to have a joint resource meeting. Traditionally, it's handled separately, but this April, everybody will be coming together for joint resource center meetings. So that is very exciting. That happens in April, and I'm happy because I get to go. I get to be a presenter, but it's part of it is it's all about how do we connect best practices in the community and help get people from clinics into classes. So to me, that was very, very exciting. And to have Meredith on the call talking about what's happening with Telligent and the Medicare community and all of the work being done there just makes it very exciting. So that's what I know about what's happening nationally and how it affects our work. And Connie, since you are on the call, would you like to give an update of where we are with year 3 of the funding through this particular grant?
Sure. Well, there's not too much since last time, but different people are on the call, so we did finally get our approval for our what are called option letters, which are basically contract extensions for year 2. So COA and AHEC are able to do all of their great stuff. And Lindsay Blackwelder, I know, has, I believe she's done the MOUs with everyone, the initial MOUs at least with all the license holders who plan to do classes this year. And so I believe those are, you know, I don't know how many people are doing them this fall because as we discussed in an earlier, several earlier calls, it makes it very difficult for people to get them started when we don't get the contracts in place until kind of late in the fall because then it runs up against holiday season. But in any case, those are in place. Carryover funds, it's going to be a while for that because I first have to close out all the books on year 2, which is behind schedule for that big software conversion that I've mentioned before that affects all of our contracting, purchasing, accounting, et cetera, systems. So that has to be done first. Then I have to put in a budget to AOA and wait for approval and then go through the same option letter process or contract extensions that we just did. So I'm thinking that that'll be more around the first of the year or so, but I don't think that'll impact things too much because we already have the ability to do some classes now. So that's it about the contract. I can talk about other things later or whatever you would like, Lindsay.
Yeah, let me just, an update from Lindsay Blackwelder. The MOUs are out to those of you who will be submitting paperwork for reimbursement for completers, and she is requesting that you get those back to her as soon as possible. So if you have it in your inbox, please sign it and return it because that's kind of a moving target for her. So please do that. And then Connie, I also thought since this is part of the funding through AOA-ACL, do you want to talk about the support community?
Sure.
At this point?
Yeah, and I can send out forward. I just got this information to Lindsay McIntosh last night, so I will forward this to everybody so you'll have this in writing. But this is really kind of a cool opportunity, I think. I found out about NCOA is working with an entity in San Francisco that has gotten a grant to do an alumni support community online. And it's for anyone who's taken a class in person or online, and it's for any of the CDSMP classes, except I don't think they have a Spanish language section, but any of the CDSMP classes. So for people who complete 4 of the 6 classes and want some support after the fact and want to or already know how to sort of navigate through web-based things, it's sort of like a little like Facebook and a little like a message board. So I went through it last night, and they've got a lot of different resources on there. But it's available, as I said, anyone who's completed 4 of the 6 classes and they can participate as long as they want. It is a grant-based program, but from what I gathered from one of the people at NCOA, they hope that it will be ongoing. So I thought that was kind of cool. So you all can let all of your classes know. They ask that you do it at the end of the last week of, the last session, or last week. But I'm thinking you could do it at week 4 because you'd have people who have completed at least 4 classes by then. And in case they didn't come back for the last 2, they would know about this resource. So all they have to do is there's a link that I'll send you in this document that you can give out to participants. It has the basics about the community, and it has a link for them to click on and just submit their name and answer a couple of quick questions about their participation in a class, and then they'll get approval from, I think it's someone at NCOA, and then they can get started.
Great.
Any questions about that? Okay. And
well, I thank you, Connie. And I'm part of what I get to do today. We have a really full agenda. Is play timekeeper. So I'm going to move us on to the next, which is also Connie. You had also sent the information on the online program, and so I have. If you have a minute to talk about that, and we have a link that's actually in the PowerPoint, but we'll also send these attachments out with the minutes.
Great, thank you. Yeah, and this is just kind of for FYI, unless anyone has questions, that we've been talking about this program for a while, which is the online version of CDSMP, and we do have that all set up and available now. Just like with our in-person classes, they kind of shut it down before the holidays, so unfortunately they're done with those for this year, but they'll be back up and running in first of the year sometime, and people can sign up now through that link, and then they'll be on the list to be contacted for the next class that they have. But so it's the same populations that we've prioritized for the grant: 60 and older with a chronic health condition, and adults 18 and older with a disability. So if you can, I think especially the disabled community would be a likely target for this, but there's lots of 60 and 70-year-olds who know how to use a computer and are very comfortable with that and may be interested in that. So that's a resource for all of you. The link that's on that I sent to Lindsay is kind of a temporary. We might have a different one by the first of the year, actually, now that I think about it. That'll be specific to Colorado, but people are more than welcome to use this right now to sign up for the next class, and then Lindsay will forward that flyer that has some basics about the program that you all can give out to anyone you think might want to do that as an option instead of an in-person class.
So, Connie, a question. I find it interesting that they are not running this through the holidays, because I would have thought the online would have sort of been available round the clock, round the calendar. Is that a new thing?
I don't know, because we didn't participate before. I don't know. Yeah, I always wish that we could get.
It's interesting.
Okay.
It'd be
nice to have that available, but I guess it's kind of the same thing for participants that get busy with other things, and you do have to do some homework for a couple hours a week in addition to being in the class. So,
right.
Yeah,
and
unfortunately.
Another question: the permanent link, is there any thought about putting that on the Self-Management Colorado site, or is that going to live on?
We could probably do that.
Okay.
Well,
I didn't know what the plan was.
That's a good idea. I don't see any problem with putting that link on there, and we won't have any involvement other than providing that link, though. It's the enrollment and all that is once we tell somebody about it and they put in their information, then it goes to NCOA and they get things going. So,
okay.
And
do we have?
I'll get feedback about numbers, but I think that's it.
Okay. And do we know, they were pricing that on a seat-by-seat basis, so there's no cost for anybody to participate in this. Is that correct? It's covered by the grant?
Yes, there's a cost to the grant, but you all, when you refer to people, you know, it won't count towards your count and you won't get any funding for it. It's all we pay. The way we're doing it, there were two different options, and we're basically doing the same way we do with the completers, so that you do for the in-person classes. So, you know, we can't build a grant if people in your in-person classes don't complete at least 4 of the classes. It's the same way with this online, the way we set it up. So if somebody participates in 3 and drops out, then the grant doesn't pay for it. But there's no real interaction with the license holders other than providing this as an option for people that you're working with, and then getting them signed up. And you could certainly keep in communication with people that you have communication with or relationship with, but they're basically on their own to do what they need to do.
Great. So just to clarify then, for those of you who might send people onto the online program, those numbers for anybody you refer to the online program do not count toward your numbers, and the reimbursement does not apply. So if you send somebody, it's going to count, it goes to Connie's grant, and it gets counted to the grant through Connie and gets paid for through Connie, but does not count against any of the numbers or any of the funding that you have. So this is just one more additional resource.
So if we have people that we refer, is there a cost to them for them to attend?
No.
Okay, thanks.
Sure.
So that's great.
It would be nice.
It was kind of pricey per person, so this is great.
Yeah, and I think it was more if we did it by completer than enrollment, but I think it's much better for us to do it by completer because, you know, if people enroll and drop out, then we'd be paying grant funds for them anyway. We'd be paying less, but I think this is just exactly what you do with the in-person classes. So. Right. Yeah, I'm happy to offer that as an option. If you ever, you know, get people that take the class and have any feedback, that would be great to hear.
Okay. And I want to, let me see, I want to go through the survey you had indicated you wanted us to do. Let me pull that up for you, Connie. It'll take me a second. Okay, now you all should be seeing a new screen that says National Council on Aging. And these are survey results that Connie sent to me, and hopefully you can read these okay. Connie, do you want to go through these, and I will scroll as need be.
Oh yeah, that'd be great. Yeah, I just thought we have an annual conference call with our funding sources at NCOA, and they do an assessment of all the states participating in the grant once a year, and then they provide this data. I haven't shared it in the past, not that I was trying to not share it, I just didn't see anything that I thought really popped out as far as you all being interested in. And I didn't provide the link to or the document for the whole survey this year because there's a lot of information in it, and I'll show you where to look at that in total if you would, in its entirety, if you would like to do that later. But there are just a couple things I thought were interesting in terms of sort of our sustainability and funding sources that other states are using. So that's what I copied and sent to Lindsay. So thank you. We won't go through each of these, but could you scroll down? There we go. Great. This showed, you know, it's some of the strengths that we have and some that we don't have, but the number of states is in the right-hand column of the number of states that said that they have this. So, you know, the first few we don't have, as we talked before, a brand name for our program and a PR plan, marketing strategies and materials that are kind of consistent across the state. So that's something we talked about in terms of, you know, how do we market that on a statewide basis so everybody knows what we're talking about. And so there's 20-some states, so the majority do have that. Then the other things that we do have a lot of those through COA and the website that COA runs, so the statewide website, calendar, toll-free number, etc. So, and then some of the ones at the end, we have some of those and not others. I don't want to go through each one, but I just thought that was kind of interesting to sort of assess where we are in terms of, you know, our strengths with the website and referral system and sort of kind of our weak side, or in terms of what we're doing to promote statewide. So we can go on to the next one. And similarly, this is business planning, financial sustainability, as you can see. And we don't have this, but as you all know, we are working on it. So with our consultant, Meredith is on the call, and then Julie and, was it Jamie is your marketing person, Lindsay?
Amy.
Yeah.
Amy's
okay.
here.
So we have.
Yeah.
Okay, we have a few new people. Anyway, just for your information, we through the grant we are contracting with a consulting firm to help us develop a business and sustainability plan for keeping things going after grant funds are not available. A lot of people will do that anyway with their own resources, but a lot of people are also pretty dependent on the grant funds, or the grant funds allow them to do more than they would be able to otherwise. So we're working on these kinds of things. It's a good list for me to share with our consultants to make sure we're addressing as many of these as we can. You go to the next one. This is just something we've touched on here and there, the number that are charging a fee for participating. And of course, this doesn't say in what circumstances and how do you decide how much and all of that, but that looks like an opportunity for us to consider, and I think that's also something that our consulting firm, Maryland Nonprofits, identified from some of the written surveys and some of the interviews that they've done, that's something people are interested in knowing more about.
Let me just point out that established per participant cost, 10 states have established that. Colorado, we're right. We use the figure $320 to $350 per person, depending on the program, so we're right in the middle of that pack. And at one point, the NCOA had released the figure $300 per participant, and then there was another one floating around of $350. So we in Colorado, with our $320 to $350, are right in the middle of this range. But that's a pretty big range, 200 to almost.
Yeah, it definitely is. They also developed a new cost calculator, and this could vary by program because I know some people have some of like AAAs lots of people have funding from other sources that is in place even when they're working with grant-funded classes. So, you know, this can vary by program somewhat, but it is interesting to see the range. Oh, this is another interesting one that, again, I'd like to share with our consultants and get a little bit more information from some states on how they're tapping some of these funds. One thing that was new to me, it may not be new to all of you, and it sounds like there aren't any AAAs. There was one person that joined, I think, after we did introductions.
Who joined us from Hilltop. Hi, Sue.
Okay, great. But we don't have any of the area agencies on aging involved, but as you may know, they have the first funding source listed there through the Older Americans Act, Title 3D, is an opportunity to fund evidence-based programs, and AOA is moving toward prioritizing evidence-based programs with a high amount of data to back up that claim of evidence-based. So, and CDSMP is very high on that list. But there's also, and in Colorado, that's not a lot of money statewide, but there's also Title 3E, which deals with caregivers. And the AOAs can opt to use some of those monies, which are more than the Title 3D statewide quite a bit more, to provide CDSMP classes for caregivers. So that's something that I'll be mentioning or asking the AAAs about when we have one of our meetings to see if they're aware of that, if, and just to let them know. But those of you who are working with agencies on aging for referrals and that might want to just ask them about that as well. They probably, right now they have the opportunity to tap the grant funds for that, but a year from now probably won't. So that's another opportunity that we could easily pursue, and nothing really needs to change for that. It's available now. And then I'd like to get information from NCOA about some of these others, especially the Medicaid. There's 2 states that get funding through Medicaid waiver and 1 from Medicaid managed care. So it'd be good to get a little bit more information about that to see how that might be able to apply to us in pursuing some of that funding.
I think every state has their set up a little bit differently. So the funding streams are a little different. Some of them have the waivers written in so that it is just a standard part of business. I'm thinking like Vermont, and I believe Oregon does too. And so I'm hopeful that we'll be able to get to that point, because that would be sort of the light at the end of the tunnel. But I agree on how they're all doing it. And Monica is on the call, by the way. Monica?
Oh, I'm sorry.
Yeah.
Sorry, Monica.
Oh, that's okay.
Okay, and then here is the last one, I think, Connie.
Yeah, and it's, I think I answered to a very small extent or not at all at this point. But like I said, as you all know, we're working toward accomplishing exactly that. So, and that contract with the consultant goes through the end of February, so that's the due date for having that in place.
Great. Let me see. The other piece that you had asked me to show was the, let me see, let me find it for you. Oh, you know what? I do not have I don't have a good list for the NCOA grant for the webinar list. It did not work well on the
okay, yeah, it's pretty
screen. That maybe you could talk about that.
Yeah, no problem. I've been really impressed with some of the webinars I've participated in that NCOA has organized. They have people from around the country who are doing different aspects of CDSMP, and NCOA also has a lot of really good expertise. The staff there, really impressed with them. Those webinars are, well, for example, the idea about working with the prison populations came from there. There was one of, they've had some about Medicare and doing the diabetes, getting certification, accreditation that is, for the diabetes classes, although we haven't been able to do that yet. They've provided good information about that. They also have some really good ones about the recruitment and retention of both participants and leaders. There's a couple on that, and that I know has been something that some people have mentioned as a concern and a frustration. We've talked about, different people have given some ideas on these calls, which are great as well. But you can use that link and go, and that goes directly to their list of webinars, and look and see what's applicable to you. It's a great resource. So I wanted to share that with you, and then the only thing I had copied off, and it was really, the font was really small, was that very page. So you're not missing anything if you click on that. You'll see all of those webinars, and like I said, I think it's just an FYI for you. And related to that actually is the next item, because which was what else, in addition to being able to look at these webinars and resources on that link that we just showed you. The NCOA staff also said that they would be interested and willing to provide some, guidance, what they call technical assistance, consultation, etc., with us as a group on issues that you think would be of interest to some of you. So maybe what, I don't know if anybody has any ideas right now, that would be great to just mention those. Does anything come to mind?
Well, I can tell you that Mary Pat and I are going to be doing one sometime in 2015, which is a webinar on connecting to the medical healthcare world and setting up referral systems. And we did this webinar, we did one in 2013, Chris Katzenmeyer and I, and it was very well received. And I know some of you have heard it, or at least heard pieces and parts of it. So they asked us to come do sort of another look at it and give some updates on how the uptake is going, not only in Colorado but in other places across the country. So I know we'll be doing that webinar. It hasn't been scheduled yet. It will probably be after April. But that again is on referral systems and some of the messaging within the practice. So.
And that's a great example of something that is available there. You get experts like COA, experts on this from around the country, as well as, like I said, staff at NCOA. And I'm sorry, I was back to talking about the webinars a bit, but NCOA could organize something specifically for us, like they did with the marketing webinar we had a while back, or it could be 15 minutes on this conference call, if that seemed appropriate, or it could be an hour conference call, or so maybe you all could think about that, and it probably would also make sense to look at that list of webinars, because my initial thought to NCOA was, how about recruitment and retention, and they pointed out that they already have webinars on that. I'm sure they would be more than willing to talk further about that, because they have those webinars already available for anybody at any time. That's a great place to start. But so maybe you could look at that list, and then next time we could ask this question again about what kinds of things do you think you might be struggling with, or would like to get some additional information about from, if you think, well, I'm having trouble with this, how are other states doing it? Does that sound good?
Yes, hi.
I think that is Glenda.
This is Glenda Mitchell. Can you hear me?
Yes.
Oh, good. And I know Meredith is on the call with Telegen, and we've been also working on a planning, which is with the state, which is a hypertension and prediabetes conference for providers, and trying to do similar things to engage practices and these linkages. And I think it's a powerful position if diabetes and prediabetes can collaborate in some fashion in that. And I think it would be good for us to have, whether it's a COA or one of the other entities on the call, be at that conference. It's going to be held in around June sometime. But I think we're actually talking about the very same thing. And it's just, I think we do need to try to come together in some respects with these efforts, because at that particular event, they're going to have, we believe, the American Medical Association heads of that organization, and it's a particular invite to physicians. So I would certainly encourage that, if you all can think of some way for us to join hands in that respect.
And did you say, Glenda, did you say that's going to be in Colorado?
Yes, it is. It's going to be here.
Oh, great.
And I know they've got a set number of people they're going to try to attract, but I'm sure we could, the collaborative could get 2 or so seats at that place so we can make those kinds of connections. I'll be there, and I know Meredith will be there.
Glenda, what conference is that? I think I missed a portion of what you said.
Yeah, it's being hosted by CDPHE, and it's going to be a statewide conference to attract providers into a referral type, to incite referrals into our programs. But the conference itself is for hypertension and pre-diabetes. But I'm just thinking that because here on the collaborative, we're having the same interest of bringing practices to join hands with us for these referrals. That's exactly what they're trying to do. So I think it would be a powerful position if we can get someone at that event as well. I'm there, and I know Meredith's on the call too. Aren't you on, Meredith? You're on the planning with us. Intelligence. What are your thoughts about that?
We can't hear you. I don't know if Meredith is still on the call, but if you are, you might have your phone on mute because we can't hear you.
Oh.
Well, let me just say that in other states, I'm thinking of the work we've done with Wisconsin and Michigan. They're doing a lot of joint efforts with their falls programs, their self-management out of Stanford, and the diabetes prevention program out of the CDC. And so they're using sort of the same best practices in terms of setting up referral systems for all of those programs rather than separating it out. And so I'm with you, Glenda. I think that makes a lot of sense.
Lindsay?
And I know Kelly McCracken from CDPHE has mentioned her support of trying to support CDSMP for people who are beyond being pre-diabetic. So she might be a good person to work with also. Glenda, you probably already are, but suggest that and see what she could do as far as putting somebody on the agenda to talk about that.
And I do
okay, then I'll be...
Kelly's going to be back on the call. She couldn't make today's, but she'll be back with us next month on a regular basis.
Okay, I'll definitely bring that up when we have our next planning meeting with the for that program.
Great.
Great. Thanks for mentioning that, Glenda.
Thanks.
Well, we are. I want to keep moving through our agenda. Just a little update on our centralized referral system. What we are seeing is a lot of the folks that we're working with in terms of through the RICOs and the ACA groups, which is sort of the advanced version of a RICO. Those are the ones that are setting up the accountable care associations, which is sort of the, I guess an Uber RICO. A patient-centered medical community or neighborhood where there are contracts in place and best practices and cost bundling and sharing. Those folks are using our website to take a look at classes, and they are also really starting to take very seriously the whole concept of self-management and self-management support, because it is more and more a part of how they want to do business. But what we are finding is we're not getting a lot of referrals that are coming directly, because what they're doing is working with the local partners, which is okay. So what is happening is we may not be seeing a lot of direct referrals through the centralized referral system, but we are seeing that it's being used a lot as a marketing, a public relations site where people can see what classes are available. They're talking with us about their awareness of the site and taking a look at classes and all of the different locations. In particular, they're loving that map with the dots on it, which, as you'll recall, was a suggestion from Lisa Waugh out of Healthcare Policy and Finance way back when we first started the collaborative. So I don't have a good sense of more numbers for you because we aren't seeing the direct referrals out of the system as much as we are the other pieces. But I just wanted to give you that little heads up. In terms of data entry, as I mentioned, Flora is not going to be on the calls with us anymore. She is going to be working with other programs rather than the chronic disease program. So Kelly will be back, and but she couldn't make today's meeting. But she did tell me everything's going great. Data entry is happy. Data submission is going well. And she did ask me just to keep reminding everybody to send in their data. And whether or not it is funded or unfunded by this current AOA Year 3 grant, part of the agreement within the collaborative is that we share that data with CDPHE. So it's all going well there.
Hey, Lindsay, this is Connie. I'm sorry. Lindsay, could I ask a question? I had my phone on mute, so I didn't jump in until when you were talking about the referral system. I just was curious if you knew, we had, for others on the call, we had done a joint presentation, like a half-day training at 2 of our locations. One was in Grand Junction, or the presentation was about CDSMP and trying to get referrals and showing the benefits and all that. And in Grand Junction, a lot of people from a wide variety of potential referral sources were there. And then in Denver, we did it just with the Denver Regional Council of Governments, which is a AAA, with their staff. And I was curious, Lindsay, if you have any idea about the results in terms of referrals that have come as a result of those either or both of those trainings?
I do not believe we've had any direct referrals from DRCOG. I do know that we're still talking with them about setting up a class for their staff on site and their referrals on site at the DRCOG offices. And the last I heard, I believe we were still looking at after the first of the year for that, so January, February. We haven't had direct referrals yet, at least that have come to us through the collaborative site. I do know that we have had discussion with them on what classes are going to be available in the metro area. So, I mean, we've had discussions, but I haven't seen any direct referrals yet. And I know Sue is on the phone and can maybe give us an update on what's happening in Mesa County. I know there was some holdup because they were getting leaders trained. So, Sue, can you kind of fill us in on what's going on? Sue may have us on mute, too. Sue went for coffee. Okay, well, I know that.
Can you hear me now?
There she is.
Can you hear me now?
Yes, we
Hello?
can.
Okay, okay.
We're here.
I'm not sure why I was muted because it said I was unmuted. So I think what we have seen here in Grand Junction is that a number of the people that were at the workshop that the 2 of you did have come back as leaders, have come forward and were trained in July as leaders. And so I would anticipate we'll see some results in terms of referrals, in terms of participation in the workshops coming up in January and February.
Great. Thank you, Sue. What organizations sent people to become leaders? Do you know?
Oh, we had one of our local hospitals, community hospital. We had our a primary care partners, which is a very large clinic in the valley. Let's see, who else did we have?
That's where Brittany is working, correct?
No, actually, she's with IPA. Primary
sorry.
Care Partners, and I think we've gotten into the right place with them. We're now in their really looking with their health coaches. So I think we're in a very good place with them. And they probably serve, I'm going to say, a third of the Valley's patients probably are in one of their practices. So I think we're in a good place there.
Okay. And this is Connie again. Lindsay has mentioned this before, but we do have some funding in the grant to do more of these. So they're, half-day sessions is the way we've organized them so far. So if you all have some ideas about doing that in your local communities, it could be focused on the area agency on aging, or it could invite a variety of other entities like Sue is mentioning in Grand Junction. So, so let me know if that's something you think might be useful in your area.
Monica, I think you should volunteer for the Valley because I think we would be able to bring together a lot of folks. And I know we are talking again with Statewide through Colorado Community Health Network on going down and doing some motivational interviewing and messaging within a practice. So if we could gear that around about the same time as maybe doing something with Connie and bringing together some of your partners, that might be a very cool thing.
Yeah, I think that would be great. And what I might do is maybe, Sue, if it's okay, maybe give you a call and talk to you more about it. Also, just so that I'm for sure understanding how it's done and that type of thing.
Absolutely. That would be great.
Okay. Okay, but yeah, that sounds awesome. Just let me know when and what. And
well, it's just a thought. You'll need to. How do you want people to do this, Connie? To reach out to you if they're interested?
Sure. I mean, Monica, if you want to talk to Sue first and then see, you're already doing a lot of great things. So I guess it is, if you think you would be able to reach out to even more, that would be, and this would be a way of doing that. That would be great. So yeah, talk to Sue first, and then touch base with me. And Lindsay, do you have that scheduled? What you were just talking about?
No, I don't.
Statewide, or? Okay.
I don't.
Right.
We're working with, for those of you who don't know, the Colorado Community Health Network is the membership organization for all of the federally qualified health centers or community health centers. And so there are several different projects we work on with them, and one of them is this piece where we go into the practices and talk about messaging with patients and with the hopes of getting not only self-management goals set with the patients, but also referrals to community resources, for example, chronic disease classes, or diabetes prevention classes, or falls prevention classes. So we just had another meeting talking about getting it scheduled. So I'll let you know as soon as I know anything.
Hey Connie, Sue, for the meeting that was done in the Mesa County area, did you guys include behavioral health? Because we're talking about care integration. The behavioral health field is really trying to integrate with the medical community. And so that might be, I don't know if you guys included behavioral health specialists or not, but when looking at upcoming meetings, that might be a good group to pull in.
I agree, and I felt bad that I don't know why I overlooked that as a suggestion, because we should have, and I agree with you 100%.
Yep.
Okay, well, I know
we'll change that in the future.
Well, and especially we have some partners in the Valley, in both sides, both San Luis and Arkansas Valley, that are doing behavioral health and are doing classes on site specifically for their patients and their clients. So they're coming from the behavioral health side almost exclusively in those classes, which is very exciting to see. But it would be great to include those folks in any work we're doing in that part of the state. So, because it is nice to see that real integration piece. So I agree with you. In terms of business and our sustainability planning, I just wanted to let you know, Connie sent out an email requesting that if you have not responded on your availability for the webinar, which is on how you can look at sustainability and business planning for your own program, This is a webinar that Maryland nonprofits would do for us, so that this is different than our whole big group sustainability efforts, which we're still working on, but this is what you can do with your program. So it's a really great opportunity for all of us, and Connie needs you to complete the doodle and let her know when you are available to attend. Did you want to say anything about it, Connie?
Yes, thank you for the plug. And I do think it's a great opportunity. Also, I found out, and those of you who participated in the CDSMP grant when it was through the ARRA, A-R-R-A funding, might remember that developing a local sustainability plan was part of that. So some of you may not have been involved in that. So what I did was AHEC still had those available. So I got all those, and I'm going to send each of you the plan that was developed back then in case you don't have it. And they really varied in the amount of content that they had, but there were a lot of really good ideas. So there's, we're not reinventing everything, and you all may know that already, so I apologize if this is something that you know about and are using. That would be even better. But in the event that they aren't being used, or there's been a change of staff and people aren't aware of them, I thought they would be really helpful for y'all to take a look at and have access to, as far as sharing ideas at your successes, as well as using some of that in redoing, updating, or starting from scratch with a new plan now. And there will be two more. I'll be doing a poll on two more events. One is a data review webinar, where Maryland nonprofits will be feeding back to everyone on the call the information they got from our meeting, or the written surveys that they did with all of you afterward, and with all the individual interviews. So that will be really interesting, I think, and a good opportunity for you all to hear kind of the feedback from a lot of the stakeholders that we hope will be able to be involved in sustaining CDSMP. So that will be a phone call. And then the last thing will be a group meeting session, probably a full day or half a day in early January, to really get into the plan itself. And our plan is to have a draft at that point, or enough content to do a draft. So both of those, I think, will be very important, and I really want to encourage as many of you to participate as you can, because you all are the experts, and we really kind of depend on your participation, and I think you would find it beneficial as well. But I'll be sending out polls about those other two. I didn't want to do all three at once because I thought it would be too confusing. But once it won't take long to set the date for the first one, which is the educational webinar about developing your own sustainability plans, because I'll have all the input by the end of the day tomorrow, and then we'll just pick the day where the largest number of people can participate. Any questions, comments? Okay.
We have just under a half hour left, and I have about half our agenda still, so I'm gonna go on here. Thank you, and I think that we will learn a lot from that. So please, if you haven't done that, please get that information back to Connie. And we just got a little note from Meredith. She had to drop off, but she said thanks for having her, and she will be looking forward to working with us all over the next 5 years of their work in the state. So that'll be nice to have her around. So we had talked about coming up with a joint recertification training, and it's been an interesting month because I haven't heard from a lot of people directly, that they would like to participate, but what I have heard from is people suggesting other people who should be on our joint recertification training project. So here's what I'm going to do. When we send out the minutes, I'm going to send out what we have available now in terms of just the agenda of how we have put this together. And again, Joni from COA's offices has been on the multi-state recertification training project. And so she knows kind of what's been going on with those pieces and parts, not only in Colorado, but in Arizona, New Mexico, Oregon. And so she's going to be a part of it. And what we're going to try and do is just do by email initially some of this back and forth. So I'm going to send it all to you. You all can take a look at it, let us know what you think, and then we will pull together the folks that have volunteered or been volunteered to participate, and then we'll bring it back to you hopefully early in the next year. Since I don't think it's going to take us a lot of time, it's just about tweaking what is already in place and branding it for the collaborative. But we'll let you all see it. So that's the update on that. And I just want to go through some of the training opportunities that we have coming up. And the first thing I wanted to just let you know, it's at the bottom, but I want to make sure I don't forget to mention it. I had a call actually from Kate Lorig herself this week, which was fun. And Kate wanted to let us know that they are updating the Cancer Thriving and Surviving curriculum. So as you know, we did a lot of the training in evidence-basing for Cancer Thriving and Surviving, otherwise known as CTS. And this January was going to be the first time we were going to be able to train new leaders in this curriculum, and we had it scheduled. It's on our website, or it was, and we were moving ahead with it, and we're very excited to be able to start doing the program. And Dr. Lorig said they do not want us to train it because they are updating the curriculum and the manuals. So we have been asked to not train in January, and hopefully the materials will be out in January. We will have to send the leaders that have already trained in the curriculum and our master trainers in the state will have to attend a webinar to get updated on the new version, and then we're hoping to be able to do that cross-training in February. So we are bummed because we were ready to go, but it's still coming. We'll still let you know when, but it's not going to be January. The other curriculum, which I know we have been waiting to work with Poudre Valley and with Julie and Susan and Ellen on doing the chronic pain self-management program, and we have a lot of the health systems are very interested in this curriculum. It too is being rewritten, and apparently it's going through a rather major rewrite, and the materials that support it are also being redone. And for those of you who are familiar with this, my understanding is the price is going down on those support materials, according to Dr. Lorig, and she would know. So initially they were saying it was going to be November, then it was going to be January, and according to Kate on the phone, it's now April. So we are chomping at the bit to train in that one too, and to do some cross-training. But we don't want to set a leader training or a cross-training at this point until the new curriculum is out. So that is also coming, stay tuned, but probably April. The next program that's going through revision is the Positive Self-Management Program, which is the program for HIV/AIDS. And that one is going to be rewritten, and so they are encouraging people not to train in that one at this point as well. As far as I know, no one is actively offering that project. We hold a license for it, but we've never been able to do the classes. So that's what I know from the Stanford folks. And I know Glenda sent us the information on Center for African American Health is doing a diabetes self-management program. What's cool about this is it's the full 4 days. So you do not already have to be a leader in the chronic disease program to go through this. And anything you want to say about that, Glenda?
Yes, on our announcement, thank you for getting that out for us. We have asked if anyone that wants to participate in our training if you could possibly get back to us by November 15th. We do want to be sure we've got a head count to make that event worthwhile. So please get back to us by the 15th and to register. And we're looking forward to having our master trainers is going to be Carol Brownlee and Lucille Johnson. So we're excited about that. It'll be here at the Center for African American Health on Colorado Boulevard and Martin Luther King in our facility.
Is there a fee for that, Glenda?
Yes, we set a $250 registration fee on that. You can just contact me about how you'd like to take care of that.
Great.
And COA is doing, as part of their academy in January, we have a number of different trainings, including what we call Quick Start, which is the marketing training, Introduction to Falls Prevention Programming, and Falls Program. But we will be doing the Chronic Disease Self-Management Program January 15th through 18th, and we do charge for that. It's $650. And there are some discounts available if you've done other trainings with us or if you are bringing more than one person from your organization. But everything's online. And then Monica, I know, has one coming up that is the Chronic Disease Self-Management Program and the Diabetes Cross Training. And Monica, you want to say anything about that?
Okay, well, no, that's pretty much it.
Okay.
There's actually no cost to that at all. We're not charging anything for it. But we might want to start thinking about that. I've always been hesitant. You know, if we can afford it, we do. And I've been hesitant just because, you know, just because of the area that we're in, and you know, I always feel like, you know, the population and whatnot can't afford it. But I don't know. It's hard for me to think outside of that. So maybe even if we did a little bit. But for this one, this particular one, no, we're not.
Okay.
And it'll be held, yeah, the 25th through the 30th. And actually, we're going to hold that through Valleywide.
Oh, great.
Over at Valleywide, yes.
Wonderful. That would be a connection with your local community health center right there. That's terrific.
It would be. And I'll have to email you the good news, yeah, because we've had some
lovely.
Yeah, we finally had some referrals this week.
Yay.
And, you know, we sent out a new referral form to get approved, or, you know, to them so that they can use. And it's been very slow, but it's starting to come around. So we're going to use them and use the facilities.
Patience, perseverance, very good.
Yeah.
Well, one more thing, two more things actually. One is, I know Connie has a limited amount of scholarship dollars available that we're going to use the same application process for this year as we did in last year, which is we're going to ask you to complete a little form that tells us who you want to train, why you want to train them, and then they are basically half scholarships. So the hope is that the programs will come up with part of the expense, or cover part of the expense, and then the scholarship would cover part of the expense. And it's based on especially where leaders are needed. So chances are we probably won't be training anybody under scholarship in Lakewood, for example, because we got a lot of people in the metro area. But we may need some specific sorts of training, say Tamondo training or diabetes training in certain parts of the metro areas as well as elsewhere in the state. So we will put that form up on the website for you, so if anybody is interested. The other little thing I wanted to mention about the trainings is Dr. Lorig reminded me of something I wanted to pass on, and so at her request, which is that we as individual license holders are all free to use our existing master trainers and book our own trainings, as you know. And then part of what we do as the license holder is report back those trainings and report which master trainers we use. And that's all great. But what we cannot do without involving Stanford is to create more master trainers. That has to involve T trainers. And T trainers and master trainers are directly under MOU, Memorandum of Understanding, with Stanford. So we can't involve the T trainers, and we can't create master trainers without going through Stanford. So, and I think we all know that, but just a little update from your friends at Stanford. So, any questions on that or any of the other training things?
Lindsay, this is Monica. I have a question. I know you did the tomato control now in November. Is that still going through?
It's actually it's going on now. It's the last day of it, and it is in Eagle County. We have 12 people going through training up there, and so we definitely have that going on. We are still trying to figure a way, and we don't have it approved yet, to do another Tomondo training in the southwest part of the state after the first of the year, but that's as far as I know.
Okay, that's what I was wondering, if there was going to be another one after the first of the year.
Okay.
Lindsay, this is Sue, and I'm wondering if you have any thoughts of bringing out Stanford to do an additional master trainer training?
We don't, just because it is very, 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 very expensive, and so that we tend to share master trainers. I mean, I know we had one of our master trainers went down and worked with Monica on her trainings in Alamosa, and we've had some that have gone to the Western Slope. But that has not been anything that we've had the budget to be able to do. And I know some of the programs that have trained master trainers have worked with the T trainers and have worked with Stanford on that. And maybe Connie can speak to the budget on that.
Okay. Yeah, I can. Can you hear me?
Yes.
I can. Yeah.
Okay. Yes, I did put in some funding for both lay leader training and master trainer training. So on the, let me clarify both. When I looked into master trainer training, I did query all of the license holders and got feedback from some about what their needs were. I also looked in the cost of doing that locally, and it, as Lindsay said, it was just cost prohibitive with our budget. But what I did put in is the partial cost of sending some people from Colorado to the master trainer training at Stanford, so covering tuition costs with travel costs to be paid by the participant or the license holder. So we would need to have an application process for that, so that if there are more people in Colorado who want the training than we can afford, then we'll need to have an application process to me, to the State Unit on Aging for grant funds, and then we'll need to work with Stanford on that to make sure that they are supportive of that. But so there is some opportunity there, but it wouldn't be a full ride. At least the travel costs would have to be covered by the local entity. And then the lay leader training, there's two funding opportunities to support that. One is what Lindsay was talking about with this partial scholarships. That's in COA's contract, so that is specific. What Lindsay was talking about is specific to COA's training, where we can fund half of the tuition for a limited number of people to go to COA's training. I also put in some funding for partial support of lay leader training. We did 2 of these last year. One was in Alamosa with Monica, and one was in Grand Junction with Sue. So I have, let's see, a little bit of training for support for that. So if people are interested in doing group training in their own locations, let me know. And well, I might have already asked about that in that survey. So anyway, that we do have some opportunity there outside of COA. So it's two different things on the lay leader training, as well as master trainer training in California.
Great. Thank you.
Sure.
Okay, we have couple more agenda items, and I'm going to do our marketing piece last, just because we have one more piece I want to make sure before we start losing people we get to, which is that our collaborative chair, which would be moi right now, my term ends after our December meeting. And this would be the end of the second year. And we had talked about opening that up and seeing who else was available, interested, willing to take on chairing the calls. And also that would involve working with things like the paperwork and the trainings and all of those pieces and parts. So in the next meeting, we would probably want to decide, since that will be December, what we want to do moving forward into year 3. I am going to not volunteer this time, in part because of my new job duties with COA. So I would say that I know that one of our staff, Mary Pat Gallis, who many of you work with, has been volunteered and has agreed to be volunteered to put her name in as a nomination for chairing next year. But we also want to really encourage other people as well. So please let me know, or if you have questions or you just want to talk about what this is or what it isn't or anything like that, please be in touch by email or give me a call. Let me know. But for sure we want to keep this going, and we want to keep growing. So that
Lindsay,
would be...
whoever is chosen, if it's not COA, would they need to have certain capabilities in terms of doing the webinar and that, or is that pretty easy to set up?
Well, they'd have to be willing to pay the price. It's about $50 a month to run the webinars. I mean, you know, it's not, we do multiple webinars. This is one of them, but you'd need a GoToMeeting account. You would need to have some technical skills. You'd need to be able to, we'd have to set up a login and be able to work with our database. You'd need to have filing systems, some coordination pieces. So there are some logistics that would be needed. So, and it's the collaborative thing is the sharing of the calls is probably just, it's a fraction of what is involved with all of the moving pieces and parts, I would say. And fortunately, we've got Cheryl doing minutes and everybody else helping us pull it together. So, so I would say there is some time involved with it and some technical expertise and the ability to have internet access and log in. We would set up a login so you could do what you needed to do on the collaborative, keeping the collaborative pages up and getting the classes in and getting the leaders in, that kind of thing. So
it would mean you wouldn't be doing the class list either?
Well,
or
it would be on our website, and so we would still be hosting it all. But you know, I think that's one of the things we would need to figure out, whether the person who was chairing the collaborative would be taking on those pieces and parts as well, or whether, you know, whether what we're looking for is someone just to chair a call. But what I thought we were suggesting was that the collaborative chair would be would really work as sort of the coordinator of the collaborative.
Oh, okay.
Yeah, because I know there's a lot more.
Yeah.
I'm sorry?
I just was
because we originally
saying
had
it
talked
was helpful
about,
to know what's involved.
Yeah, and when we originally had talked about it, we had talked about that the technology pieces, whoever was chairing the collaborative would have access to. So that would, for sure. But, I think one of the questions is if we're going to continue moving forward and if the collaborative chair is going to be the person who is doing part of that work, then we probably need to look at the collaborative chair doing more than just the calls. Because I would say right now that's what it is. So if we want to talk about not doing it that way, then we can talk about that, or we can talk about it offline, or if other people want to call and ask questions. Does that make sense?
Yeah, that sounds good.
Okay, great. Well, we have just a few minutes left, and so I know Connie had asked us to put together. So anyway, let me just say one more. So collaborative chair, moving forward in January. Who's interested, please be in touch. And now we're going to switch to the marketing spotlight. And Connie, I'm going to turn this back over to you. You had asked us to pull together all the different names that are used in the state for the chronic disease program. And do you want to talk about that a little bit?
Yeah, do you have the list on there on your
Yep.
website or your PowerPoint?
Right there.
There we go, yeah. And Cheryl, I think, did this, and I appreciate that. I added one at the end, which is the online program. Also has another name. So this covers a lot of ground. There's a few that are the same, but across a couple license holders, but generally there's a wide variety of names that are being used, and that does create challenges as far as marketing something statewide. As I mentioned before, calling it, the official Stanford name isn't very appealing to people who would want to sign up for the class, the chronic disease self-management program. Because chronic disease has a negative connotation even for people who have one, and then most people don't know what self-management is either. So I know there are mixed feelings about that because people have materials in their own names and are used to using that, but I don't really know what to do I would like to be able to, and we need to, as far as sustainability and reaching out to potential other stakeholders and funding sources and all that, have a way to say a quick way to say this is what we do. And the name that conveys that as concisely and clearly as possible in an appealing kind of way. So I wanted to see what you all thought in the last 3 minutes that we have, or maybe 2. Where do we go from here? What thoughts do you have?
Connie?
Yes.
Connie, this is Monica. Is it possible to just maybe come up with just a few names and then everybody vote on it and come up with one name and we all use that one name? Only because I've been asked several times, do they have a class in Canyon City? Is there anyone that puts these classes on in this area or this area? And you can give them names and number and whatnot, but it's easier for for them to relate so that they know that they're the same classes. I don't know if that would be easier just to say that everybody goes by the same name, and those that are looking for that particular class knows that it's related because of the name number 1.
That is certainly one approach we could use, yeah.
Yeah.
Well, and I know whenever, this is Crystal from Secahec, I know whenever we went and named our class, we weren't sure if we could use any of the other names, so that's why we went away from one of the other names, because we just wanted to make sure we weren't taking it. So I think the idea of a poll with several names and then allow people to choose, because I like the idea of having one, and then, but then we just have to make sure all those partners and everybody is aware of that and they're willing to use that name.
Mm-hmm.
Well, and I think that's a big part of the conversation is, are we willing to do that? Because I know we've put, back in the day, once upon a time, all of the classes were identified as Healthier Living Colorado or Healthier Living Colorado Diabetes, and then through the ERA funding, or I shouldn't say all of them because Kaiser was calling them something different. But then after the ERA funding, when we have all the different licenses, was when then everybody had the option of coming up with different names and things. And so it's hard because, for example, at COA, we've been using those same identifiers now for 7 years, going into 8 years. And so it's, it would not be an easy, you know, I think we would really have to be thinking about whether that makes sense for us to do. I will say that how we approach it from the collaborative basis, and if you look on the collaborative site, we have things which I'm not sure if this is enough or not, but I'm just throwing it out. On the collaborative site, you'll see that there are program series like the self-management series, and it'll say diabetes or, you know, chronic conditions. And then every class is listed, and when you click on a class, for example, in Canyon City or in Alamosa, then you get what the class is called within that community. And so when we've been making presentations on behalf of the collaborative, what gets said is it's called different things across the state, but it's all this same curriculum and this same program, which is Stanford's self-management program for people with chronic conditions. And so we do frame it that way, which is not quite as short as I know Connie would like it, but it's definitely, we're trying to make sure that the messaging includes that no matter what it's called, you're going to get the same curriculum. So,
oh, that makes sense, yeah.
Anybody else want to weigh in on the name?
You've also said that a lot of people aren't using the website, and we certainly reach out to people by more than just the presentations that a few of us make. So, I mean, I would like, ideally, everyone would agree to do that and make whatever sacrifices they needed to make in order to have more of an impact when we're reaching out to different funding sources and partners and stakeholders. It would be, it just would be more effective. I mean, I don't think anybody can argue with that. We could come up with, I mean, if there are people who just aren't willing to or interested in doing that, we can come up with something that's used for everybody else. And you know, I don't control everybody. I know that this is, as one of the reasons I wanted to show what, and we're out of time here, but to show what other states were doing, and some states have made it a mandate to begin with that everybody use the same name, and it just is easier. You don't have to explain that there are all these different names, and I have heard feedback from people about the confusion of going on the website and seeing different names and wondering if what so-and-so does is the same as what somebody else does. And
well, I'm not, my concern is right now COA is probably, well, I would say we are the largest license holder in the state, and since we are, since we do a good portion of the classes, I'm really hesitant to change what we're doing that we've had a pretty good long track record of doing, and that we were using with a number of the other license holders before they became license holders. I mean, if people are interested in going back to using the Healthier Living Colorado, the Healthier Living Colorado diabetes, those kind of things. I'm happy with that. And I know that Wells County does variations of that. Kaiser's doing variations of that. That doesn't necessarily mean they would be operating under our license at all. They would still, everything would be the same, but it would be kind of like what Kit Carson does. Kit Carson is still calling it Healthier Living Colorado. So if people want to do that, and we do some branding around, using the names of what is the majority of what classes are offered across the state, I think that makes some sense. I'm not sure. We have a lot invested in terms of time and money in that branding and in what we've been doing for 7 years. So that would be my concern.
So that's another approach to it that Monica and Crystal were talking about, narrowing the list down and voting. And you're suggesting another one, which is everybody do what COA is doing. So I don't know if there are other options, but we are at 10:35. So
this is Eve. I have a comment that I would like to just offer, and I'm not passionate about any particular way of labeling the classes because we all have done it according to what we were comfortable with. But I think when we brand it, if we do make a change, that we consider the population that we're serving, which is people that have chronic diseases. And these are individuals that sometimes have conditions that make it difficult for them to remember. They're tired. They're focused on their condition. So we don't want to make it complicated for them. So that's just my 2 cents. Maybe it's just my nursing background that guides me. So I would do whatever we all collectively decide would make it easier for our clients.
So you're saying something that's clear, simple, clear, understandable, gets the point across quickly, that kind of thing?
Yeah, probably, yes. I mean, the last thing people with chronic conditions want is to have to think about what the name of the class is that they want to attend. And I think it is confusing, as much as we each kind of have our own opinion of what we think it should be called. I think it is a little confusing when every location has a different label. It makes it a little bit more difficult if we want to refer somebody or mention to somebody in another area that the class that is held in another area is labeled differently. It does become confusing.
Well, and the Healthier Living Colorado, is that trademarked, Lindsay? It looks, when I pull it up on the website, it looks like it's trademarked. So
yeah, we trademarked it. We've trademarked it back in 2000 and I guess it was 2008, 2009 when it was being used across the state for all of the classes. And so what we would need to do is just have an agreement. We would just allow you all to use it, so it wouldn't be a big deal.
Well, how about, since we're out of time, and I would like everybody to have a chance to weigh in, the others that aren't on the call, I could develop like some questions, and not to try to make a final decision, but get input on how people would like to proceed with this, and give a few different options for how to do that, and not focus on, let's vote, or let's pick one right now, but engage everybody in, getting some more input, just like we're having today. And then we could put it on the agenda again for next time. Does that sound okay?
Sure. I think we need to have some conversations offline too, because I think that whatever we do with this, Connie, really will has dollars and cents attached to it as well. And so yeah, I think we have some other pieces and parts. But definitely let us continue the conversation on the December agenda. Okay, well, I think we are now at the end of our time. Actually, we're past time. Thank you all for hanging in there. Our next meeting is on our Friday day, which is Friday, December 7th. Be there or be square. And I will get this, we'll get the minutes out. Actually, Cheryl will get the minutes out. And, oops, I lied. It's Friday, December 5th. I can't, thank you, Amy. Friday, December 5th, not the 7th, the 5th. And we will do the same thing, 9 to 10:30. We'll talk marketing and names and collaborative chairs, amongst other things. And Joni will be getting this posted on the website, so if you know anybody who was not able to be at the meeting, they can download it there. So thank you all, and have a really great weekend.
Thank you.
Bye.
Bye.
Thank you. Bye.